Okay, welcome everybody. My name is Dr. Vince Leone, and this is our first Express webinar in this series. I'm the owner and of Specialized Practice, but the niche today, the webinar today, how to pick your first or second high ticket niche. So if you're here, welcome. Very excited to have you here. You're in the right place if you are thinking about adding a high ticket niche to your practice. And by the way, what is a high ticket niche? High ticket niche is a high value cash service for chiropractors. And so in other words, it's something outside of just traditional chiropractic. We charge all cash, and they're typically in the range of around $4,000 up to $6,000 for care packages. So if, this is really for probably like three types of doctors. One, no niches in the practice. And so you or they are thinking of, hey, I like the idea of a high value cash service in my practice. What should I choose? Second type of doctor, I have a successful niche. Which would be a good second niche, right? And then finally, the third type of chiropractor, I have a niche, it's not working, it's not right for me. I need some guidance on what a correct new niche for my practice would be. So if that's you, you're in the right place. Welcome. We're very happy to have you here. And we're Specialized Practice. That's my company. I formed it back in 2016. And our whole goal, all we do is focus on helping doctors add high value cash services and then grow them. And we have three primary services under our Specialized Practice banner. Our first one is called Profit Niche. This is our flagship program. It's our 12-month coaching and consulting. And this is really where most doctors should start. Okay, so this is for doctors that are just going to add a niche. Right. So they have a successful chiropractic practice. Now they want to balance out their revenue streams, add more cash, specialize in one of these niches. This is a 12-month coaching and consulting. It's a fantastic program. We get excellent results, and you will literally have everything you need to start and grow a high ticket niche. Our next service is called Elite Ads. This is for doctors that already have a niche. And for our Elite Ads program, this is all we don't do traditional chiropractic advertising. It's just for our high ticket niches. We focus on spinal decompression, chronic knee pain, peripheral neuropathy, and plantar fasciitis. And so this is for a doctor that already has a successful practice, already has a niche, and they just need new patients. And then finally, our top tier program called Apex Coach. This is really for doctors that are 100K a month and beyond. And, so they have the clinical in place, they have the systems in place, they have the marketing in place, they're doing quite well, but they want a coach, they want to optimize, and they want to go to that next level. How can we optimize revenue, increase by 10, 20, 30%? How do we, increase my time off? How do I increase my systems or optimize my systems in practice? So it's really just kind of, already very successful in that kind of top 1 to 2%, which is where we were. And, how do we go above and beyond? Because a lot of times, if you get to 100K a month, 150K a month, it's kind of like herding cats at some point, unless you have really, really good systems. But we're just trying to refine things at that point so that you can start to be more in that CEO role. So if any of those are of interest to you, we do offer free consultations, either with myself or with my client success manager. And you can go to drvincecalendar.com. You will fill out a survey that gives us a good sense of whether it would even make sense to jump on the phone, because we do only do free consultations with qualified doctors. But you'll go through that. And then, like I said, you'll find a time on a calendar, fill out the survey, and you'll if it all makes sense, then we'll go ahead and have that call with you. Now, we will do Q&A at the end, like a live Q&A. In other words, you can, I'll unmute you and you can jump in. I think that we have that technology, but if not, or sorry, throughout it though, if you have a question, just go ahead and put it in the chat. And let's see here. By the way, let's go back once. Yeah, in the chat, let's see. It should be on the bottom of your little toolbar on the Zoom thing. And by the way, just let's see if it works. Someone type in, "I can hear you," if you would, in the chat. I would really appreciate it. Otherwise, you may be just hearing nothing, but I tested everything. It should be working. It'd be nice to know that the chat works also. So if someone could type in there, that would be great. Now, what are we going to cover today? This is really we're going to, the whole idea with the Express webinar series is, let's see, someone typed in the Q&A, Michael Smith, "I can hear you." Yeah, so let's skip the chat then. It looks like the Q&A is the best place. Thank you, Michael. Thank you, Dr. Smith. Appreciate that. So the idea behind the Express webinar series is really to be really focused so that we can deliver great value in like 30 minutes. I've been on a ton of webinars. I've hosted a ton of webinars, and sometimes, most of the time, there's a ton of fluff. So we're going to try to, just really narrow down on a very specific topic all around high value cash services and deliver it to you so that you can go about your day, but get good value in the time frame. So what are we going to cover today? We are going to talk about the most prevalent and profitable niches that you should be choosing from. We'll talk about which niches to avoid if you want to have fun and be profitable. Not really on the have fun. I'm sure you could have fun with some of these other niches. They're just not as profitable. And so I want you to be as profitable as possible. Then we're going to talk about our 3-part process at Specialized Practice so that we can help our clients choose a niche it's something that they can, it's going to work for them for the next 10, 20 years. And then a realistic time frame to have your niche up, running, and profitable so that you can plan appropriately. Now, quickly about me. Again, we're not going to spend a lot of time here, but just so you know that I kind of know what I'm talking about. Built a 7-figure decompression and neuropathy practice. I don't know why it's just decompression, but we did decompression. We did a ton of neuropathy. We did some knee pain, of course, and some plantar fasciitis. But we were doing, anyways, $1 million practice. I wrote 3 ebooks, all on these topics. I founded Specialized Practice back in 2016. From an advertising perspective, in our practice, and we had 2 other clinics. So we had 3 clinics all under our banner of Sound Pain Solutions. And we invested $4 million over a 5-year time frame with a 7-to-1 ROI. So that's pretty good. And so I have a lot of depth and experience on the advertising side. And now I am a full-time coach and consultant, and have been on different media sources, all talking about this, podcasts, etc. So our YouTube channel is one of the most watched in the chiropractic industry. If you want free training, I mean, it's not like laid out perfectly, but if you want free training on high ticket niches, if you just search up Dr. Vince Leone on YouTube, you will find me. And there's a ton of really good information there for you if you want to dive into that. So now bonuses. Love to do bonuses. If you stick around to the end, excuse me, I'll send you all 3 ebooks, and that's the Ultimate Guide to Neuropathy for Chiropractors, a 6-figure decompression map, and Riches in Niches. So those are good quick reads. You could probably read them in 30, 40 minutes. They're not, again, they're ebooks, so they're not like 300 pages, but they're very good in terms of especially if you're early on in this process. And I'll show you how to get those at the end of the webinar. Now, let's dive in. Most prevalent and profitable niches. Spinal decompression is always at the top. And this is typically the niche I recommend most doctors start with. Now, why is that? it's because it is perfectly in line with our current model, right? We are already experts in the spine. Now, most doctors are not experts in disc, if we're being honest, right? I mean, we study it a little bit, but are you an expert at reading MRIs? Are you an expert at diagnosing disc problems? Probably not. And that's not a crack on you. I mean, we're musculoskeletal, right? So we're adjusting the spine. Well, for discs, we can take pressure off a disc if we put a bone that's out of position and put it back into position, but we cannot hydrate the disc, right? The disc is 86% water when it's healthy, and when it is not, it is somewhere less. So if it's bulging, herniated, or degenerative, it needs to be hydrated. And that's why decompression is so awesome. It's the best non-surgical, drug-free, FDA-cleared therapy for getting water back in the disc. Nothing else gets water back in the disc. Now they can cut the disc. They can try to replace the disc. They can strengthen the muscles around it. We can adjust the bones, and so that we take pressure off it. But nothing other than spinal decompression puts water back in the disc, because it creates a negative pressure in the middle of the disc, allows it to absorb water from the body. Right? That's the beauty of spinal decompression. So that's the easiest one. Now, if you're thinking, but I thought spinal decompression was saturated, and nothing is further from the truth. So first of all, if you think about every chiropractor that has a decompression table, just take half off the list. Why? Because the vast majority of doctors do not use their decompression table. It literally gathers dust. And it's because they haven't specialized. They haven't really dove into the niche. They were sold the table, right? The company did a really good job selling them the table, but they don't do a very good job of teaching you how to start and grow a niche, right? That's what we do. So half of the doctors out there with the table, which is not even, maybe 10% of all chiropractors has a decompression table, maybe. And the point with that is, spinal surgeons, they have a waiting list practice. That means there are so many people with disc problems that need some type of therapy for it. And most would love to avoid surgery, but they don't know about us. They don't know about spinal decompression. So please, 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 please do not think that spinal decompression is a saturated niche. There are so many patients out there that need our help. Okay, so spinal decompression, wonderful niche. Back pain is a huge problem in the United States. And so there's plenty of patients, wonderful niche. Chronic knee pain, awesome niche, right? Because it's a weight-bearing joint. Tons of people have, millions and millions and millions of people have chronic knee pain. And these patients, by the way, are great, right? Because they are usually in their 40s, 50s, and 60s. They are active, and the knee pain is stopping them from doing what they really want to do, what they love to do, which could be exercising, walking with their spouse, golfing, tennis, hunting, hiking, you name it. These people want to get back to doing what they love to do. And the chronic knee pain is stopping. Now, I'm not talking about like some mild knee pain issue. No, I'm talking about chronic knee pain, right? Meniscus, ligament issues, where they're considering surgery. And so we have a phenomenal protocol, robust, that gets patients, saves them from surgery, saves them from 6 months of PT, and gets them back doing what they love to do. So chronic knee pain, fantastic niche. Peripheral neuropathy, fantastic niche. This was my first niche in 2009. This is the niche I started with, and maybe not the best niche, honestly, because it's a complex niche. So neuropathy. So if we look at the top 3 chronic diseases in the U.S., diabetes, I believe, is still number 3. Diabetes is the number 1 cause of peripheral neuropathy, right? So 70% of all peripheral neuropathy sufferers come from diabetes. So you can start to see how massive this niche is. So it's a fantastic niche, but it is complex. You need to be super sharp. Okay. And it's not musculoskeletal. This is a nerve related issue. It's a metabolic issue. It's a whole body issue. So you really need to be very fine tuned on your clinical. So, but if you can deliver results, and we can with our protocols because they are fantastic, but if you dive into this niche, if that's something that is of interest to you, you can help a lot of people and be extremely profitable. Plantar fasciitis, fantastic niche, mainly because just up until recently, we haven't had a real great approach and solution for it. And so plantar fasciitis, while it's not as as prevalent as some of those other ones, still a very, very good niche. Weight loss. Weight loss is, they always talk about like markets, right? Like what is your total addressable market? What's called a TAM, TAM, total addressable market. Well, in the United States, that is quite large. There are a lot of overweight people in the United States. And no offense, but it's just the reality. And now there's a lot of competition here, but if you can just get a little bit of that market, you will make a tremendous amount of money. Now, that's not a condition that we train on. We focus on those top fours: spinal decompression, chronic knee pain, peripheral neuropathy, and plantar fasciitis. But that doesn't mean weight loss is not a good niche. It's a fantastic niche. I did do weight loss for a short time, about 1 year in practice. I didn't personally enjoy it. Was it profitable? 100%. But it just seemed, it seemed like no matter how much weight they lost, they were never happy about it. And so to me, it was out, like, obviously it's within our scope of practice. We can help these people legally, but from a clinical standpoint, a clinician standpoint, I just didn't love it. So it's a great niche. Okay. So it's a big niche, lots of people to help, lots of money to make. Just not something that we address because it's not interesting to me. And then functional medicine falls in the same category as weight loss for me. We don't train on it, but still a great niche. Tons of people out there that need help from a functional medicine standpoint. So another great niche, just not what we train on. Next, let's talk about which niches to avoid. Now, I'm not saying that these are bad niches in a sense like you shouldn't treat them. I'm just saying these don't have as large of markets. And so you don't have as many people to help. And also, the care plans are typically not as big, right? So in other words, they're not going to be as profitable. And if we're going to go through the time, effort, and energy of adding this service to our practice, I want it to be profitable for our clients. I want them to, sign up a patient for 5,000, be like, whoa, boom, love that. Sign up 2, woo, 10K day, love those, right? So, but these are, if you're going to do these, it's going to be like 1,000, something like that. Just not that exciting to me. And again, this is strictly dollars and cents. I'm not talking about like, hey, I don't want to help these patients. So I do want to be clear on that. Everyone needs help. It's just that what we train on, I wanted to deliver big results for our clients. But niches to avoid, in my opinion, okay, these are just my opinion. Carpal tunnel, right? My dad, he had this little carpal tunnel test, where you the thumb and the pinky, and you pull it apart, and strong or not strong, adjust it, boom, done. Got great results. So, but do we need lasers and shockwaves and all that type of stuff? No. Carpal tunnel, would I help someone with it in practice? Yeah, 100%. Would I try to add that niche to my practice and expect, big revenue stream from it? No. Golfer's elbow, same. Tennis elbow, same. Shoulder pain's right on the border, right? But it's not a weight-bearing joint. Do people have significant shoulder injuries? Yeah, that we can help with, 100%. Is it a big package? Not really. Neurofeedback. I'm sure it works, right? Like doctors are doing it, they're getting good results. I believe them. Do I think this is a massive audience? I don't know. I mean, maybe with COVID, there's a lot of ADD and kids suffering, which bums me out to no end, of what COVID did to our kids, young kids in school. Because I have two, I have a 10 and a 13-year-old. Thankfully, I don't feel like they have any long-term effects, but I know that certainly some kids do. And from what I'm told, neurofeedback is helpful for that ADD and all those issues. Is it something that I know forward and backwards? Not even close. So I don't teach on it. And I just don't know how, long-term results we get and all that type of stuff. So I would say that would be a niche to avoid. Okay. Any questions? Again, post it in the Q&A. And I will address it. Otherwise, we can go live at the end. Now, let's talk about our three-part process on how to choose a niche. We keep it real simple, but super effective. Space, pace, and budget. Number one, space. How much space do you have in your office to dedicate to this niche? Because you will need space, right? And so if you have, significant space, like, hey, I have an extra room, or our office is 3,000 square feet, plenty of room, then great. You're wide open, right? You can do any of the niches, frankly. The one niche that's going to take up the most and need the most space is spinal decompression, right? These tables are not small. They're significantly large, actually. And if you get an AccuSpina or a DRX 9000, they're massive. We had DRX 9000s. We had 4 of them. And then 4 MLS lasers, right? So, and those are the big, tall robotic ones that stand up and move and all that type of stuff. So you need space, right, for those. Now, some of the tables, like the Hill DT, shout out to Hill DT. We're doing the Decompression Summit certification in September in Dallas. You should come. We only, by the way, have 6 spaces left. We have 84 people registered. So if you are interested in that, if you are interested in decompression, I'd highly recommend that you want to actually learn the absolute best, all aspects of a decompression practice, go to decompressionsummit.com and register. It's only like $600 and it's going to be awesome. But again, we'll max out and we'll fill that up very, very shortly. But point being, back to decompression, even the Hill DT, which I really like that table, that's still pretty darn good size, And so we got to have the right space. Now, if you have not very much space, then I would look at the other niches, right? Whether it's all the other niches really don't take up very much space at all. Okay, so knee, neuropathy, and plantar. If you're short on space, I would choose from one of those 3. If you have plenty of space, I'd go decompression. Now, let's talk pace. All right, space, pace, budget. Pace. What is your practice like? You know what I'm saying? Like, in other words, do you have an older practice, like a slower moving practice? Like, are you an older doctor? Are you in your 60s or 50s and you have a lot of Medicare patients? I'm not saying 50 is old, by the way. I'm 50. I just turned 50 this year. And doggone it, I'm saying 50 is the new 40, and I'm just going to live by that. So, but back to your practice. Do you have a lot of Medicare patients? Is the typical pace of your practice slow? If so, neuropathy would probably be great, and you would need to be okay with be strong clinically and complex cases, and you'd have lots of potential patients, right, with your strong Medicare base. If your practice is younger, right, more active, younger, and the pace in your clinic is more brisk, then I would avoid neuropathy and I'd go to decompression, knee, or plantar fasciitis. So that's pace. So it's kind of like, what is the style of your practice? And you want the niche to match it. Because 2 things. One, if you try to take a slow niche like neuropathy and put it with a brisk type of practice, there's going to be a conflict there. But 2, where are you getting your patients from? Now, 100%, you should be doing outside advertising for the niche, right? And all the numbers work wonderfully. But you also want to be able to get patients for the niches from your active practice, right? And from your past patients. So, and from your just typical new patient flow. So if your typical new patient is in their 40s or 50s, a lot of them are going to have knee pain. A lot of them are going to have disc issues, and a lot of them are going to have plantar fasciitis. So you can just get, the easiest way, guys, the easiest way to make more money in practice is to have a nice chiropractic practice and then add services, right? So you have all these people that already know, like, and trust you. Now you're just going to offer something new that you're really good at. Okay. So the pace. And then finally, budget. What is your budget for the niche? Like you're going to need to invest. Like, don't get me wrong. This is not free. If you want to make a bunch of new money, add a huge revenue stream to your practice, and we'll talk about what the potential is here shortly, you're going to need to invest, right? So, and what I can tell you, I'm not going to go into the specific therapies and all that type of stuff, because that's for clients, but the least expensive niche is decompression by far, okay? The most expensive niche is going to be knee and neuropathy, okay? Again, our protocols are very robust. If we're going to ask a patient to write a check for $5,000, we're going to fix them, okay? Our protocols are going to fix them at a very good clip, about 80 to 85%. So we invest heavily. Now, I'm not saying $100,000, like, don't get me wrong, but there's a price, right? There's a price to pay to play in this field. So what's your budget? I would say that the least expensive niches are spinal decompression and plantar fasciitis. The most expensive are knee and neuropathy. Okay, so that's it. That is your guide frame. Those are your guideposts on how to choose your first or second niche: space, pace, and budget. Now, you're probably wondering, well, what, if I'm going to add a niche, like what is a realistic time frame? I don't want to be doing this for a year. And I totally understand. I don't blame you. But it comes down, we have to have some qualifying factors here. Okay. So if you have the right equipment picked out, in other words, good price from a good manufacturer, if you have the right training from a clinical perspective, guys, you've got to be an expert. Just because I use this analogy, I know that's kind of silly, but if I bought like some fancy Porsche or whatever, does that make me a race car driver? And the answer is no. It makes me a guy with a fancy race car. Now, if I went and trained on a track how to do corners at 100 miles per hour or whatever the heck those guys do, then I'm a race car driver. But until then, no. Okay. So if you're going to be an expert and you're going to have a niche, and say you're an expert in decompression, which is disc or neuropathy or knee pain or whatever it may be, you got to be clinically an expert. It sounds kind of silly, but I'm serious. A lot of people just call themselves, hey, I specialize in this, but they don't have the training, right? So got to have the clinical training. You got to have the proven protocols, right? You have to deliver the outcomes. You got to have the right price point. Okay. So some doctors, their area will warrant and allow for a higher price point on their care plan. Some won't. Some doctors don't feel comfortable at a higher price point. Some doctors want a lower one. So we got to get the right price point for you and your area. And then you have to be able, you got to have the skill sets to enroll a patient into a high cash care plan. In other words, you can't roll out the old Chiro ROF. Like, you need to have an ROF specific to your niche, and you have to address the concerns. You need to create clarity for the patient of why we're doing cash versus insurance and what these therapies do and why they're not covered by insurance. You got to answer all those questions, right? Because a confused mind will say no. So I'll repeat that because it's important. A confused mind will say no. And especially when it has a $5,000 care plan tag attached to it. So got to be able to do that. And then if you have or can do all those things effectively, 90 days. Okay. 90 days, and you will have a high value, profitable care plan, niche attached to your practice up to speed, and rocking and rolling. Now, I've had doctors ramp it up within 30 days. So I like 90 days. I just feel like, hey, if we're going to add, a whole bunch of money, probably double, triple your current practice revenue, if we're going to add that, I think, it's kind of fair 90 days. I mean, goodness gracious, there's always like exchange of value. But I've had doctors that are, hyper motivated, and they've done it in 30 days. But just as a rule of thumb, I'd say, hey, 90 days, if you can dedicate that to picking out the equipment, getting your protocols, getting your staff trained up, getting your systems dialed in, getting your clinical dialed in, getting your ROF dialed in, getting the marketing dialed in, 90 days, and you will be golden. Change your life. So what is a reasonable, what can you expect, right? If you're going to go through the training, if you're going to invest in the equipment, if you're going to do all this, what can you expect in terms of revenue? About 10,000 up to 50,000 a month is what you can expect. Okay. So if you think about that, if your average care plan is $5,000, at 10,000, it's literally 2 patients a month. I mean, guys, that's not that difficult. I mean, obviously that's not difficult. But the point being is, I would probably say, say you did decompression and say you get 20 new patients a month. About 10 to 20% of all just chiro patients coming into your clinic are their disc patients. Now, whether you determine that or not, whether you recognize it and refer them to for decompression, that's a different story. But if you have that type of new patient flow, and most doctors are somewhere in that kind of 20 new patients a month, maybe 15, but you will have decompression patients, and so it is not difficult to get to 10 grand a month. It's very easy, actually. But if you really focus, right, and your care plan's 5 grand, and say you do a little bit of marketing, and you stimulate your own patient base. 4 new patients is 20,000 a month, right? If you go hard and you're like, hey, I'm gonna do some Google, I'm gonna do some YouTube, I'm gonna push this in my practice, gain up to 50,000 a month, totally doable. But trying to figure it out on your own, probably not. So now Dr. Pankin, he's a wonderful client of ours. He's been with me since 2020. When he started, he was doing about 45,000 a month. Now he's doing 100,000 a month, right? So he was able to add $50,000 a month. Dr. Marjan, have you ever had an $8,000 day or a $10,000 day? That's what she's doing. I mean, how cool is that? Dr. Abrams, all cash. He doesn't take any insurance, and he's all cash and doubled his practice. And, obviously very nice things to say. Never saw anything like this in 23 years in practice. I'm thrilled that he has it. Still a client, been a client for 2 years, continues on. He's fantastic. But, he's doing shockwave. He's doing decompression in addition to his chiro, just crushing it. So pretty cool, right? I mean, can you doctors start to see the value of this, of adding a niche and adding the right niche for your practice? It is very important. Adding the right niche, doing it in the right way. Now, if you would like some help, if this has been valuable for you, if you're like, hey, yeah, I can see doing this. And yes, I would like some help. I don't want to try to figure it out on my own. I always kind of liken that to running through a forest with a blindfold on. It's that's what it was like for me when I started out. Got some bumps and bruises. That's why I do what I do, so that I can help doctors avoid all that, right? And so they can add a niche quickly, efficiently, and profitably. We have, our doctors get an extremely high ROI on their investment with us. So if this is of interest to you, if you want to explore the possibility of working together, go to drvincecalendar.com. Again, you'll find a time on my calendar. You will then fill out a survey, right? It's going to ask you, well, how much money do you make? And, what niches do you offer, if any? And, just like 5 questions. It's pretty simple, but it gives us a good sense of, would we be a good fit before we even jump on the phone? So you can go to drvinceCalendar.com, sign up for an appointment there. Would love to talk with you, especially if you've been on this webinar, because I appreciate your time and I want to give back. And so one way I'd like to give back is those bonuses. So if you want to get those 3 ebooks of mine for free, just send me an email, support@drvinceleone.com. And in the subject line, just put express webinar. So in the subject line, support@drvinceleone, express webinar, and I will send you those 3 books for free. So once again, drvincecalendar.com if you'd like to schedule a free consultation to talk about working together. And finally, Q&A. Do we have any questions? Now, I don't know if we're able to actually have you come on live. Maybe we don't. So if you have any questions, just go ahead and put them in the Q&A or the chat, whatever works for you. Would love to answer them. I'm not seeing anything coming on, but I'll leave it up. And I just want to thank all of you for attending, and tell a colleague. If you have a friend, colleague that is a chiropractor, tell them about this. And I'm going to send out a replay. You'll get a link to the replay, forward it to them. Let's try to pay it forward. In my opinion, honestly, in my opinion, adding a niche to your practice is the single most, it's like the biggest lever you can pull in your business, 100%. It's not supplements. It's not high volume, because high volume is just going to break your body down. Our whole process is staff, systems, and technology does the bulk of the work. We focus on high value activities, which is evaluating the patient and enrolling them into care. And then staff, systems, and technology takes care of the rest. So what does that do? It adds significant revenue to our practice. So $10,000 to $50,000 a month. That's not a year, a month, right? So $120,000 to $600,000 a year by adding 1 or 2 niches. Do you see the power of this? And by the way, you don't have to do the work, because the way we have it set up is staff, systems, and technology does all the work. Okay. And in the process, the patient gets outstanding clinical outcomes. Your expertise and your status in your community skyrockets, and the value of your practice skyrockets. All of a sudden, you're able to significantly put money into savings, into investments, go travel, buy toys, pay down debt quickly, because you're generating so much cash revenue every single month. It's playing at a higher level. It takes an investment. I'm not going to lie to you. It takes an investment of time, energy, and resources. But once you do it, oh my gosh, the results are phenomenal. So that is our show today. That's our webinar. I went a little over. I was shooting for 30 minutes, so we got to 38. I'm sure I'll get better at doing this. But anyways, I want to thank you all so much for attending this Express webinar by Specialized Practice. Again, go to drvincecalendar.com if you'd like to schedule an appointment. And thank you for your time. It's very much appreciated. And again, if you want those bonuses, just send me an email at support@drvinceleone.com, and and just put Express webinar in the subject line, and then we will send those ebooks out to you. So have a wonderful weekend, and God bless.